right, it looks like it has slowed down and everyone has settled in. So thank you all for being here and good afternoon. My name is Casey. I work for the EMS for Children Innovation and Improvement Center. I'd like to welcome you all to today's Pediatric Readiness Recognition Program Collaborative's welcome session. The EMS for Children Innovation and Improvement Center and the Pediatric Pandemic Network are supported by the Health Resources and Services Administration, also known as HRSA, which is within the U.S. Department of Health and Human Services. The contents of today's presentation are those of the authors and do not necessarily represent the official views of nor an endorsement by HRSA, HHS, or the U.S. government. So again, thank you all for being here and joining today's welcome session. This session is being recorded and will be posted to the EIIC website along with today's slides. Please feel free to add your questions throughout the presentation into the Q&A chat feature, and a discussion will follow the presentation to address your questions. During today's presentation, we'll be addressing the following questions. How does pediatric readiness and recognition fit together? Where to start? And why are state partnership program managers joining the Pediatric Readiness Recognition Programs Collaborative? And what are the next steps? So to begin, I would like to introduce Dr. Kate Remick, who will be helping to answer the question of how does pediatric readiness and recognition fit together?
Thanks so much, Casey, and I want to apologize up front. My internet is a bit unstable today, so for most of this, I am going to be off video, but I did want to turn on my video to at least say hello, so you all know I'm actually here. But thank you, Casey, for kicking us off. Just before we dive into Peds Ready and pediatric recognition, I want to give just a little bit more background and highlight the fact that this collaborative is really co-hosted by the Pediatric Pandemic Network and the EMSC program as really a collaborative effort. We've talked about the Pediatric Pandemic Network in the past, and many of you hopefully know a little bit more about it, but just to reiterate, the Pediatric Pandemic Network is a new specially funded program through the Health Resources and Services Administration, as you just heard, and the goal of this network is to raise our nation's response to pediatric disaster through the influence of children's hospitals and through collaboration within community and coalition partnerships. The Pediatric Pandemic Network is primarily composed of 10 core children's hospital hub sites, but they are working collaboratively across their region and with the EMSC program as a core partner, and we're really grateful for this partnership moving forward. So jump into the next slide, please. So when it comes to disaster readiness, pediatric readiness is really the first step to that, and that's why, in large part, the Pediatric Pandemic Network is invested in this work too. Just as any other community, we can't have a readiness to meet the needs of many if we can't meet the needs of one. But this graphic here really describes kind of the landscape of the Pediatric Readiness Program, starting from the left-hand side to the right, and just really trying to help provide a visual of how all of these pieces fit together. So as many of you know, the National Pediatric Readiness Project kicked off about 12 years ago now, and really is a joint effort between HRSA EMSC, now PPN, as well as the American Academy of Pediatrics, American College of Emergency Physicians, the Emergency Nurses Association, and newly the American College of Surgeons Committee on Trauma. And the foundation for the National Pediatric Readiness Project was initially this core NPRP assessment, which is based on joint policy statement or joint guidelines for what every emergency department should have to meet the needs of children. You all are, of course, very familiar with this. The initial assessment kicked off in 2013 and then again in 2021, with some opportunities to engage in the assessment at intermediate points in between. And this initial gap report that you see demonstrated here is really a first snapshot for EDs to say, where are my deficiencies when it comes to meeting the needs of children, and how do I begin to address those? The next step on this landscape was to provide a checklist and a toolkit for these emergency departments to identify resources that they could adopt and adapt within their local facilities. This has been available now since 2012 and continues to be updated and revised based on the latest guidelines and remains on the EMSC Innovation and Improvement Center website for use. But what we have found out over the many years since the National Peds Ready project has been in effect is that simply knowing about readiness or having access to resources and checklists is simply not enough to cause an emergency department to become pediatric ready. We also know that there are a few key drivers of pediatric readiness that have come out of the NPRP assessment. And those include having a pediatric emergency care coordinator or engaging in quality improvement methodology or efforts. And thus came the idea that we could maybe support some of these teams through ED-focused quality improvement collaboratives. And many of you are aware that we've launched a number of these QI collaboratives over the last 7 years or so, some that have focused on ED-based teams, multidisciplinary teams, some that have focused more on pediatric emergency care coordinators specifically, some that have been focused on specific areas of clinical interest, whether it be suicide or telehealth, but all of these with the hope that we can help raise the bar for pediatric care through improvements in pediatric readiness overall. Recently, the National Peds Ready Quality Initiative provides a dashboard where sites can begin to measure their performance on specific aspects of pediatric emergency care delivery in order to drive improvements. You can see a snapshot of those dashboards over time. But all of this can best be packaged in the creation of what we call pediatric readiness recognition programs. And the intent of these is to really bring awareness to and celebrate those emergency departments that have committed to maintaining certain levels of pediatric readiness. Based on the information we now have from the 2021 assessment and the previous assessments in 2013 and 2003 initially, we know that there are certain factors that really impart an improvement in outcome, namely high levels of readiness. Dr. Craig Newgard and Stephanie Ames have demonstrated that that's probably somewhere around the 88 to 93 mark on a pediatric readiness score. We also know that having a peds emergency care coordinator and having a QI plan in place are critical. And these are just some of the elements that a pediatric readiness recognition program might consider as part of their criteria. We've spent a lot of time over the last many months within the Peds Ready community of practice talking about those criteria. Some of those have been integrated into the EMSC performance measures, as many of you know, including things like weight and kilos. And now, additionally, we know because of the continued gaps in pediatric disaster plans or the inclusion of children in overall disaster plans, that there's a real need to begin strengthening that work as well. And now, of course, disaster plans are on the horizon as a new EMSC performance measure. So all of this is to say that the pediatric readiness recognition programs are really kind of the last push to ensure and verify that EDs are indeed ready. We've given them the resources, we've given them the tools, and now we want to recognize them for their contributions and their work to ensuring high quality care for children. If you go to the next slide, please. A similar landscape exists with the pre-hospital pediatric readiness project, which kicked off in 2019, just prior to publication of the national guidelines. And those national guidelines, similar to the National Peds Ready project, form the basis for the PRRP assessment, which we know is going to be rolling out in 2024. And while we don't have all of the data that we do have for the National Peds Ready project or what's taking place in EDs, we know that this assessment will be critical for us to identify some of the core gaps and the core drivers to improve outcomes in the pre-hospital setting. The toolkit and checklist for pre-hospital Peds Ready have already been created and are available for those EMS agencies that are working to improve their readiness. We've also hosted a number of EMS-focused quality improvement collaboratives, whether that be focused on PECs or other aspects of quality improvement work. And on the horizon are pediatric dashboards that are coming out of NMSIS to help provide essentially web-based analytics or ability to measure the delivery of pediatric emergency care in the pre-hospital setting. And this can all be packaged up finally in a EMS-based Pediatric Readiness Recognition Program, which is really what we're headed towards, where we can truly verify that EMS agencies are adhering to the most critical elements of pre-hospital pediatric readiness, and that we're congratulating them and recognizing them for that work. So this is really just intended to provide a background on how all of these items fit together. And this is not dissimilar to what's been done with trauma centers, stroke centers, STEMI centers, where they've all gone through a process of saying, what are the structures we need in place? What are the items that we need to check off? How do we develop quality improvement programs and ensure we have coordinators to oversee that work? And lastly, how do these centers become recognized? And so we really do view this as hopefully the last step on this pediatric readiness journey. Next slide, please. We kicked off this collaborative initially in 2014 under the auspices of the National Resource Center and then with support from the EMSC Innovation and Improvement Center. And at that time, we had 14 states that were engaged in this work, and we learned a tremendous amount from that and from the many subject matter experts who were a part of that initial quality improvement collaborative. And for this next round, we know that there's a need to really begin to expand our work into the EMS setting as the Pre-Hospital Pediatric Readiness Project has kicked off, and really help support each other to grow these recognition programs. There are some states that certainly have the lead in this arena, states like California, who had the first EDAP program, states like Illinois, who have a tremendous amount of engagement, and a number of other states that now have recognition programs in place. But even so, you'll see that many of them continue to participate in this collaborative because there are always opportunities for enhancement of either the criteria to align with our evidence base and or to expand our programs to begin to engage more rural and remote agencies and emergency departments in those communities. So this is a 16-month collaborative that is beginning in September 2023 with the all grantee meeting. Will extend through December 2024. While this seems like a relatively lengthy amount of time, for those states who have gone on their own to create these programs, in many cases it took upwards of 5 to 10 years to really get to the point of formal recognition. But what we found with this first collaborative is that many of those 14 states who participated made immense strides, and I think the evidence even further supports our ability to accelerate the creation of these programs. We will be pulling together many, many resources, some from prior collaboratives, some from the PEC Learning Collaborative that was launched in 2018, as well as many other resources and shared best practices that many of you bring to the table. So we're excited to have 50 of the 57 EMSC state partnership programs participating. You can see them outlined here in blue, along with the U.S. territories named below. And we can't wait to get started with all of you. I'll pass it back to Rachel Alter, who's going to take us into the next steps of this.
Thanks, Kate. I'm going to quickly jump on video as well. I also have some unstable internet, so just wanted to say hi and thank you everybody for joining. We are going to just quickly look at where kind of the process phases of developing either a AD or EMS-based readiness recognition program. Next slide, please. So to start, we're focusing on the phases that you do report to HRSA in your EHB currently for hospital recognition programs. So we're also going to be using these same phases to identify progress for your EMS side of things. So starting with no progress, obviously at starting at 0, research, development, a process or plan, piloting your program, and then formal recognition is that 5th and final step. Next slide, please. So in thinking about our first phase of research, this is really looking into gaining an understanding of your state system, whether that be your hospital system or your emergency medical services system, looking at identifying the partners that you would need to collaborate with to really help move this process forward. We do encourage consideration of a SWOT analysis to look at strengths and weaknesses of your system, and then really looking at formalizing a plan and timeline for your recognition program. Next slide. Phase 2, we are looking at the development of your program. So we encourage you to look at other state programs that have been established and review their criteria and kind of identify what may or may work in your state. And of course, there might be other things that you might want to add. We know that no state's really going to be able to completely replicate another system or program. But looking at what other people have done could really help you identify what could and could not work in your state or territory. So along with that, we're going to be looking at developing your criteria for either that hospital or EMS recognition program. And then lastly, really defining what the verification process will look like for either or both of those programs. Next slide, please. So our third phase is the process or planning phase. So here you're really going to dive into identifying what those program characteristics are going to be, along with gaining the partner agreement from your first phase of identifying who's going to be at the table with you. So ensuring that that whatever compromises need to be made get made during this phase to ensure that your partners are going to be able to really support and help you market your program. Then to develop your implementation plan and timeline, and then outline your workflow process for whatever your designation system is going to look like. Next slide. Our fourth phase is going to be piloting of your program. Oh, sorry, okay, there we go. Sorry, a little slow here. So looking at both phase 4 and phase 5. So finding your hospitals or EMS agencies who are going to be willing to pilot your program and really looking into what that process is going to look like. And I think that what most people are going to find is that while they pilot it, there's going to have to be some tweaks to the things that they've outlined within their system. And then the final step here is formal program launch and the celebration that goes along with that. So you're going to recognize these phases from your EHB reporting for your hospital recognition program. And like I mentioned earlier, the EMS recognition program process will look pretty similar in process. Of course, your stakeholders and how you go about it might be slightly different, but overall that process is really going to look pretty similar. So if you've already done your hospital recognition program, you might have gotten some road rash about how that worked or didn't work, and be able to manage this EMS side a little bit differently. But in any case, we are going to be here to help you walk through all of that, depending on what phase you're in. And for those who may have already formally rolled out either hospital or your EMS program, part of this collaborative support can be working through what you already have formalized, and we can help you ensure that some of the new elements from the new performance measures are incorporated if they're not already there. So next slide. With that, I am going to hand this off to a couple of your colleagues. Margot Kneffelkamp from Indiana is going to kick us off with why they've joined the collaborative and lessons learned from their experiences in launching recognition programs, and she will be followed by Morgan Skaggs from Kentucky. So thank you, and I'm going to hand it off to Margot, I'm sorry, Margot. Thank you.
Okay, thank you, Rachel. I'm Margot Kneffelkamp. I'm the program manager for Indiana, and I have been in this role since May of 2016. So we'll just dive in here, please. Next slide. Back in 2018, post our consensus conference, Indiana emergency departments were able to apply to be recognized as pediatric ready or pediatric advanced. We do have a voluntary 2-tier program in our state. Pediatric ready represents the minimum requirements to ensure an emergency department is prepared to care for any child based on the guideline of care of children in the ED, or pediatric advanced which includes slightly higher standards for pediatric preparedness in the emergency department. Indiana's pediatric facility recognition program, as I said, is voluntary, and a third tier may be developed post our pilot evaluation. There are 132 emergency departments in our state. 34 of those are critical access, and 19 are small rural hospitals. 2 emergency departments did close last year, and one of those 2 was a critical access hospital. And then this year, another critical access hospital has announced that it will be closing. 14 of Indiana's 54 rural hospitals are at risk of closing because of continuing financial losses. 92 counties comprise Indiana, and 76 of those counties are wholly or partially rural. We do have 7.1 million residents, with 1.6 million of those being children. These logos here represent Indiana's EMSC program partners who worked alongside us to design Indiana's program when we went through the collaborative back in 2016, 2018. Next slide, please. Indiana's current state, our applications did launch in November of 2018. Since then, 2 Indiana emergency departments were formally recognized in February of 2020. This included an application process. The application was then reviewed internally, and feedback was sent to the applying emergency departments, which included a 3-hour in-person site visit. During the site visit, the emergency department shared a SWOT analysis of their pediatric care capabilities with our team, and then we walked through the emergency department to verify that the ED had met all of our criteria. We then reviewed documents and questioned and finished our visit with closing remarks. Our team then discussed the visit, and post-review contacted the ED with a certificate and letter notifying them that they had met our program's criteria. Currently, we have reviewed another application and provided feedback to that site to address missing criteria. We have received another application just last month and is currently under review with our reviewers. Overall, since we launched in 2018, 17 applications have been requested, and 5 of those are critical access hospital. And then just 2 weeks ago, we met with Illinois' program to start the process of transitioning 3 Indiana hospitals that are verified by Illinois EMSC to then start completing Indiana's application process, which is, our program is very similar to Illinois'. Next slide, please. A few of our struggles since launching, COVID came. We had just completed our 2 Indiana site visits in February of 2020 on that Thursday. And then by Sunday, Indiana had their first case of COVID. We know that smaller hospitals have leaner staff, and turnover is making it challenging to complete the application. With momentum, there's new breath with the NPRP. That with the launch of that in 2021, there was more questions. When the hospitals got their gap reports, they reached out to us wanting to know how they can help with those gaps, and like what they can do with like low-hanging fruit to make sure that they can increase their pediatric readiness. Trauma centers have been reaching out with the standards that they have to address a gap with their pediatric, with the NPRP on their gap report. And then what I hope to gain, going through the collaborative, I enjoyed someone else driving. I was new, I had just started, and the collaborative had started 2 months before me. So we were late joining, but we were easily caught up because someone was helping us navigate that. You know, where to start and what phase of implementation, just things that I wasn't very familiar with. My background was managing a different HRSA grant, not pediatrics. And so it was an opportunity for me to learn the ins and outs of EMSC. And it also was an opportunity to learn from my peers. I reached heavily to Illinois and their program that has been around for 2 decades, just to learn and to see, you know, what they offer here in Indiana with the 3 hospitals that were verified, to see if we could try and replicate and learn from them. And then managers have various experience and skills. And then just being brand new really helped me connect the dots and get to know my peers and know that we are all on the same mission of improving the emergency care of pediatrics. I'm going to hand it over to Morgan Skaggs. She's our peer there in the program administrator for Kentucky EMSC.
Hi, everyone. Good afternoon or good morning, as the case may be. I am, as Margot said, here in Kentucky, and most of you have had a chance to meet. Some I look forward to meeting in Austin. So the Kentucky EMS for Children program is located within the Kentucky Board of EMS. And we've got a strong connection to our PPN hub in Louisville that I'll talk about towards the end of my portion of this presentation. Next slide, please. We have both an ED and an EMS recognition program. I started in my role here in Kentucky in 2011 and have had the good fortune to participate in the Facility Recognition Collaborative in 2017. We also did a PEC Learning Collaborative grant in 2018-19. And we had the supplemental outreach grant in 2021. So all of those things have contributed to the progress that we made. We did really learn a lot with the Facility Recognition Collaborative and helped make major moves forward with our ED recognition program. And at the time, I happened to be completing my bachelor's degree and chose to mimic that process by creating our EMS recognition program as my degree program capstone project. So I kind of did a little double dipping there on that one and got credit for my degree program as part of that. So both of my programs actually were established and did their first recognitions in 2018. Kentucky has 120 very small counties, about 4.5 million people, and we have 100 hospitals and we use the 157 as our number of EMS agencies. Kentucky has an interesting licensing structure, and many of our services hold more than one license. So we do have to go through those sort of one at a time to determine whether it's one agency or separate agencies as we look at the actual licenses. Next slide, please. So for our ED recognition program, we really struggled initially with the concept of multiple tiers, and a lot of our subject matter experts were very uncomfortable with evaluating inpatient capabilities of our hospitals. So we chose something that was a little bit more attainable for us, which was to focus on a single tier recognition of the emergency department. So we recognize pediatric ready emergency departments. And our overall criteria is simply the joint policy statement, pediatric readiness in the emergency department. We do allow for accommodations and exceptions as deemed appropriate by our committee. We have found that, the presence of a nurse PEC in the ED is crucial to the success of the program. But we do have some small hospitals that are very dependent on locums physicians, and that they sometimes have a challenge in identifying that pediatric champion, or they may not do central line placement in an infant. And in those cases, as long as they have an appropriate treatment plan to stabilize and transfer that patient to a higher level of care, we may accept that as an alternative. We did develop a steering committee that's made up of representatives from our 2 children's hospitals, including state chapters of our ENA and ACEP. We've had minor participation from our state AAP chapter, but we really look at our 2 children's hospitals as big drivers. And I do have to give accolades to our representative from the Kentucky Hospital Association, who's played a significant role in a lot of our work. We do have a pre-review questionnaire that hospitals submit prior to arranging for their site visit, and we also evaluate a lot of their policies prior to that site visit, which is completed by a team of at least 3 people that usually consists of myself, a physician, and a nurse from one of our children's hospitals. We do have a 3-year recognition, And we did allow for the option that a renewal site visit could be done virtually versus in person. Although if we do complete a virtual site visit for renewal, the next 3-year renewal would be done as an in-person visit for sure. Currently, we have 11 out of our 100 hospitals recognized as having a pediatric ready emergency department. For our EMS recognition program, we did use a focus group of EMS agency PECs to establish our criteria, and it really is sort of a yes, no. They either meet the criteria or they don't. So we based our criteria on the existing performance measures at that time, and we created a program handbook that really explains all of the steps and requirements to interested agencies. It is a 1-year recognition, and so EMS agencies do apply every single year for this. They report on their previous year's activities when they renew, show that they've met the criteria for that previous year, and then apply for the next year. And that's the same with those applying for initial recognition. They have met the program criteria for the calendar year beforehand. Our recognition period or application period is January to March of each year. And we meet in April as the EMSC committee and approve those applications. And then we do our big public announcement on EMS for Children Day in May. We do issue a certificate to the agencies, and we have decals that are printed and placed on all the ambulances or support vehicles. And we do offer to attend a board of directors or city council, county council meetings if an agency requests at least once to actually issue their certificate plaque in person. And we give them a good public pat on the back and sing their praises in front of that board or council member. Currently in 2023, we have recognized 36 of our 157 agencies. Next slide. Some of the things that we've kind of dealt with over the last couple of years, obviously the pandemic had a significant impact, and we did see some slowdown within our EMS recognition program. We got very lucky in one respect. Because our application period runs January through March, we actually had just sort of completed all of the applications right prior to the pandemic lockdown. So we were able to confer recognition in 2020 at a time when a lot of agencies were busy with other things. In 21, we did see 4 agencies not renew their recognition, their pediatric recognition, but we did gain 4 additional services at that time. And then for the last 2 years, we've added 6 additional services each year, which has brought us to the current 36. For our emergency department program, we saw significant delays related to the pandemic. We had a site visit scheduled in April of 2020, and that one was postponed for more than a year. We actually completed that site visit in September of 21. And in 2022, we did see some renewed interest and have recognized 4 facilities last year. K-Beams, the Board of EMS, faced legislative action that physically and administratively moved our organization out from under the Kentucky Community and Technical College system and back under state government. We lost access to our grant funding for almost 6 months. We've had to completely change all of our internal processes for purchasing, reimbursement, and compensating our site visitor teams. We're in the process now of trying to complete retroactive contracts for work that continued during our transition. And we're being told we have to develop a bid criteria and personal services contracts for future site visitors. Next slide. That's, increased the struggles that we're dealing with currently. We find that personnel time tends to be one of our largest problems. The program here, while we have a lot of support from various partners and our advisory committee, the actual kind of day-to-day work of the program is really done by me, and I don't have support staff to share that with. We're struggling with the new processes that we're trying to understand and comply with. And I don't really see significant changes to some of this without additional funding. Some things that have really helped keep us moving forward, the supplemental grant funds have been useful and have played a role in recruiting additional interest in our hospital recognition program. The ACS trauma criteria requiring that evaluation of pediatric readiness and introducing plans to address gaps has really spurred a lot of interest from our trauma programs. And even our EMS services have seen a significant increase in awareness of pediatric readiness as a concept, and that is driving interest as well. So from my past participation in collaboratives, I know there is a lot to be gained from this process. It's an opportunity to learn from others' work, to share the workload with some of your colleagues in other states. Even though I have existing programs, I think this is a great opportunity to review our current program criteria. I know, increasing the emphasis on disaster plans is something we really need to step up in both of my programs. So we're looking for new ideas and processes and resources that might be created or shared. And ultimately, I'm really looking for some help with sustainability of this program. And I hope that's something that we'll be able to talk about collaboratively as we work through this process. Next slide. I do have to briefly talk about our connection to the PPN Trauma and Burn Hub. We have a really strong relationship between our program and the PPN Trauma Burn Hub, and that really developed organically. Dr. Mary Fallett, who's well known at both statewide and nationally, is the kind of PI or the oversees both of these projects, which created a natural connection. And I saw Abby join the call earlier, so I have to give a shout out to the PPN Hub manager. We claim credit for helping fill that role. We shared the hiring notice when that was put out, and Abby was an agency PEC and someone that I was already familiar with. And so I like to say we had a role in making that connection. And so that existing relationship just really paved the way for ongoing work between our two programs. So we've shared contact lists and background information. We've helped make introduction, and this has gone both directions. Abby does a lot of things and connects me to people as well as me being able to share information with her. So, we have kind of different networks, both in state and between states, and we are able to utilize our contact with various subject matter experts. And then I have a program set up in base camp for both my ED and hospital and EMS PECs, and we're able to utilize that distribution network as well. The work of the PPN has really played a good role in a strong role in supporting ED pediatric readiness. And we have one specific project that started under our supplemental grant where we had worked with one of our transport teams to do trauma outreach education as sort of a perk to participating in that grant project. And that sort of morphed over time into a QI project for the PPN Hub. And I look forward to our continued efforts together. It certainly makes the work a little lighter when you can share it with someone. So I encourage state programs and PPN hubs to build those connections and work together on your recognition programs as well as other projects. That's all I had for you today. That took longer than I expected, sorry, but I'm going to hand it over to Lisa Gray with the EIIC to talk about what's next.
Thank you very much, Morgan. Hello, everyone. My name is Lisa Gray. I am a nurse with the EIIC. I co-lead the trauma and hospital domains. I've had the opportunity to be on calls with many of you, but I'm happy to be here today to share a little bit more. Casey, if you'd like to move to the next slide. I hope you all, I do want to take a time out really quick. I want to take this opportunity to thank Morgan and Margot both. They have joined us on the planning committee for the collaborative to really make sure that we keep state partnership managers and the work that you all are doing applicable and usable for you all. So I want to thank them for their contribution before we go any further. That being said, I may be the bearer of bad news, as I'm the one that has to present a little bit of homework that you have before we get together in September at the all grantee meeting. So we are going to conduct an environmental scan. So I know in previous community of practice calls for our recognition programs, we've talked about having an inventory of recognition programs across the state on the ED side. And we really didn't have a thorough compiled assessment or document of everything I think that that might be helpful for all of us to know. A couple of people, my predecessor, Diana Findia, and even some of our state partnership managers have done a phenomenal job at compiling a lot of information. But now that we have several new state partnership managers and folks who are, and lots of new programs coming on, we thought that before the collaborative, this might be a great time to do an environmental scan or an assessment of what's out there, both on the EMS recognition side and the ED recognition side. So we're going to do an environmental scan in REDCap. You will get a product out of it after hearing from you all on previous calls that you would like to use a document or some type of resource to get in touch with others, get in touch with your peers who may be in the same phase of work, or want to talk about lessons learned, want to work on different aspects of recognition. We heard from you all that this would be a great tool to have. We would also like it on the EIIC side to help really guide some of the work of the collaborative. It will give us an opportunity to look deeper into what's happening across the country and in the territories. So we can ensure that we're giving you good information as we move through this collaborative over the next year or so. So this environmental scan will assess our current state, in process, active programs, as well as programs that haven't had the opportunity to start yet, and maybe it's in the horizon. It will help identify barriers and facilitators to recognition program, really from the lens of the EMSC national priority areas, specifically a performance measure that we're about to embark on. Next slide, please. So this environmental scan will be a REDCap survey. There, you will notice it is one survey, but it has two parts. It has an ED recognition program section, and it has an EMS recognition program section. Some of the questions are very similar, but most of them are built on branching logic, depending on how you answer prior questions. For those of you who haven't had the opportunity to start this work yet, you might not have many questions to answer. Those of you who have robust programs and are either in the pilot phase, or have officially launched, unfortunately, you will have a lot more questions, but none of them are meant to be stressful or take a lot of work. I think a lot of this information we learned from Morgan and Margot when building it, that a lot of this information is stuff, if you will, that you already know. So hoping that it won't be a burden, too much of a burden, but really great information to have as we move forward. Next slide, please. A couple clarifications I just wanted to go over, and I'm going to give you an example, or I'm going to review the sections or components of the survey as well. So right off the bat, after you enter your name and your state or territory, you will see this section about your multidisciplinary team. I want to clarify that this is not intended to engage them in the work of the environmental scan or the survey. This is to really put them on communications for the collaborative as we move forward. So it will compile a distribution list for us that will help you all engage other members of your team as you move forward with this work. So please don't hesitate to include others. Know that they won't get bombarded with a lot of information about the survey or even go into the survey and fill that out. It's really just to engage them in future work. Or future work for the collaborative, I should say. I also should probably backtrack and clarify. I know we have great participation on this call today. Over 80 folks have joined us. This survey is only for our state partnership program managers, our EIIC colleagues, EMSC, PPN. It's not for you, you're off the hook. It's just for our program managers so we can again assess our current state of recognition in both the EMS and ED side. Next slide, please. So a summary of the questions that we will ask that are present on the survey. First of all, we know that all of your programs are not one size fits all. There is diversity among your programs. Each state may look a little bit different. So we do want to ensure that you answer the questions based on your program to the best of your ability. You'll start off right off the bat, answering if your recognition program is active or a work in progress. Branching logic will resume from there. And then we'll dive in a little bit more on the phases of development. We also cover the application process and how you all go about that, as far as, do you have a team of individuals who review your application? What do you do with the information once the application is reviewed? So on and so forth. We do dive into criteria. They're very familiar criteria to you, but we want to know what states, what criteria is being upheld for folks. So I believe they're check boxes based on guidelines and checklists. So all information that you've already seen. We want to learn a little bit about your verification process as it exists, whether it be virtual, in person, a hybrid of both. Most importantly, we have text boxes or free text areas for your support and enablers, as well as your barriers. So please feel free to use those text boxes. If there are important things about your program, information that you'd like to highlight, not only about what has worked well or what challenges you've had, if there's some nuances about the questions that you think that it was hard for you to explain your process or your program, please feel free to include that information in the free text areas. Again, we will only have 57 of those to compile. I say only, and that's a lot of work, but we will be able to read them closely and make sure that we highlight nuances in the information that we give back to you. Next slide, please, Casey. So what's next? The survey link will be sent to you this Friday, July 28th. You do have a deadline to complete it by August 11th. And there is a reason for that short turnaround with a deadline. We want to give a report to you back at the all grantee meeting kickoff. So you will not only see a report of your state, you'll also see reports of what other states look like. So you can reach out to individuals as you move forward in this work. I do want to mention before I close how much I look forward to meeting some of you, most of you, and seeing you at the all grantee meeting and the kickoff for this collaborative. We really are working behind the scenes to make it fun and interactive and a great start ahead. So at this time, I do also want to mention, if there are any questions that you have, if you're in the survey, really don't know how to answer a question, it seems confusing to you, you need some clarification, please just email the collaborative's email that you see on your screen. That will be where the survey link is coming from, so you can just reply to that email. And I think that's all I have.
Thank you, Lisa.
We did just, let me turn over to Julie, or do you have
we wanted to also make sure that our individuals who be receiving the environmental scan were aware that it would take no more than 10 to 20 minutes to complete. But it's really important to allow us to help you and be aware of your current state so we can continue to plan for the collaborative. But it will also help our state partnership program managers begin to evaluate their current state. And so we can actively work on that together moving forward.
Thanks. All right, without further ado, I'm going to turn it over to Julie Shelton. She is one of the advanced quality improvement specialists with the PPN. Take it away, Julie.
Thanks, Lisa. Hi, everybody. Like Lisa just said, my name is Julie Shelton. I'm the Advanced Quality Improvement Specialist with the PPN. And Casey, if you want to go to the next slide. I'm going to tell everybody really not just next steps, but what to expect in the coming months with the collaborative. As mentioned before, the Pediatric Readiness Recognition Programs Collaborative is a mouthful. So we are shortening it to the PRRP Collaborative. You might also hear PRRPC, but there's a lot of acronyms. So it will kick off with the pre-conference session at the all grantee meeting in Austin on September 11th. And during this time, attendees will be participating in the interactive activities to help you get started with plans for designing or improving your state's ED and or EMS Pediatric Readiness Recognition Program, wherever you are. So the activities will also allow for attendees to network and get to know the stages of other states' programs and discuss the similarities. The collaborative will be a space where participants can learn from each other in addition to the resources that will be provided to you. And next slide. So after the kickoff in September, we will then meet monthly starting in October, and we'll meet monthly through the end of 2024. We'll meet on the third Thursday of each month from 1:30 to 3 o'clock Central Time. Again, these are virtual meetings. So the first kickoff session will be in person, and then after that, we'll meet virtually. And during the monthly learning sessions, we'll be covering topics like quality improvement and tools to help with the recognition programs. We'll look at how the EIIC communications team can help support states with their programs, and then how to create a program that is sustainable and have long-lasting positive outcomes. We'll also go through other topics to support you, whatever stage you might be in with your recognition program. And throughout the collaborative, we will all work together to support state and territories in developing and improving recognition programs, whether that be ED or EMS or both. And then the next slide. So another next steps slide. Your next steps, again, you're going to receive this environmental scan survey this Friday. We ask that you complete that by August 11th. Again, it should not take you any more than 10 to 20 minutes, depending on where you are in your phases. After the environmental scan, you're going to travel to Austin for the all grantees meeting in September. We will meet at the pre-conference on the 11th of September, and we'll kick off our wonderful collaborative. And then after that, we ask that you participate in the collaborative, engage with us. We'll meet monthly starting on October 19th, and we'll learn from each other, we'll grow together, we'll improve together, and we'll have a good time. And so I will now turn it back to Casey for questions and answers.
Thank you so much, Julie, to all of our presenters today. So again, please use the Q&A feature in your Zoom taskbar to ask your questions, and we'll share them back to our speakers. So we have one here. Perhaps Margot or Morgan, this would be a good question for you guys. For those with successful programs up and running, I'm curious, how do recognition programs used by the community ED, let me rephrase that. So how is the recognition program used by the community EDs? Do they post it on their website, use signage? In other words, what have you seen that works as the carrot? Morgan, you might have an answer for that you can share with the group.
This is Morgan. I don't know that I have an ultimate answer, but
What your statement
most
do?
of our hospitals, when we do confer their recognition, we usually do hand off a framed certificate type plaque in person. Most hospitals have initiated some sort of press attention with that. So we've seen online news articles, or the local newspaper has run a story on the program and the hospital's recognition. They do hang that plaque usually somewhere in a waiting area where it's visible to the public. I don't think we've got wide scale public recognition yet of the program. So I'm not sure if they're getting as much bang for the buck on that as we would like, but it's something we will continue working on.
Thank you, Morgan. And do you see another chat or a question in the Q&A feature that's already been answered, but I do want to share it with the larger group. Can we focus on developing one EMS or hospital recognition program, or do we need to be working on developing both? I don't know, Rachel or Lisa, if you would like to elaborate on that.
Yeah, so this is, a voluntary collaborative. So there's no requirement to work on both or one or the other. So whatever you feel like you've got the time and ability to do, maybe there's been progress already made in one, and this can just help move that progress a little bit further in whichever one you've already done, or if you're starting from scratch, pick out of the hat and decide which one you'd like to work on. There's again, no requirement to work on both at the same time.
And keep the questions coming.
So yeah, seeing the questions in the chat, to Cindy's comment,
I think we're gonna lose Rachel.
it keeps like popping into my brain and then leaving. Oh no, have I cut out?
You're back. You can take it, or I'm happy to. Go ahead.
Okay, so I'm trying to figure out what part of those performance reports we may be able to get from HRSA, and maybe we'll be able to pare down some of the questions we're asking in that questionnaire. So thanks again, Cindy, for pointing that out, and we'll do our best to ensure that we're not duplicating things you've already provided that we can be privy to as well.
I do want to add to that, Rachel, that this information is a little bit different that you'll see in the environmental scan once you get in there and go through it. Again, it's pretty brief. It shouldn't take at maximum, hoping no more than 20 minutes. But it really gives us the opportunity to look at the program across the country as a blanket really statement. And we don't really get that information, that detailed information from the EHB reports, et cetera. So I'm hoping that you find this information in the survey is a little bit different than what you submit. And it has a different purpose. It's going to help us guide the collaborative as well. I totally get though that it's a lot of work.
Thanks, Lisa. And to the questions coming in about requirements and HRSA approval and such, just know that HRSA is aware of these concerns, and we'll be addressing the specifics during the upcoming performance measure implementation manual webinar that I believe is scheduled in a few weeks from now. Sorry, I don't have a more concrete answer for you than that at this point.
It's also important to note that participation in the collaborative is not dependent on having a program that has already reached that level of that process with HRSA, but really all states and all current levels of recognition programs.
So I'm seeing Mark's question, how do we answer the survey for Lisa then? There is a question in the survey that says, has HRSA received, I'm gonna paraphrase here. Has HRSA received your application documents? So this is one of the things that we're gonna work on, really setting or learning setting a standard to what needs to be submitted to HRSA for the application process and what that looks like on their end. So you can still answer there is a specific question that says, have your documents been submitted to HRSA? It's a yes or no, and there is no wrong answer. We don't have a process set up for that yet, but we're looking to the future as recognition becomes more of a priority. Recognition programs become more of a priority in the future. I hope I answered that to the best that was clear.
And to Kelly's question on whether or not there can be a list of the programs which are officially approved by HRSA, I do hope to have the performance measure web pages on the EIIC live within the next week or so. And on there, we will be listing those programs and where we can, linking out to the individual web pages and information from those states.
Hi, Rachel. I was having trouble following the chat. And Lisa, I was having trouble. I can't see the entire question. Is the question whether or not HRSA has recognized a state?
Yeah,
this recognition program.
yeah. There's some comments about getting the programs approved. And not being sure what the requirements are that HRSA will be looking for to receive that HRSA approval.
So you're correct. The performance measures manual webinar will draw the list, but we can pull those details out so that you can complete the survey. But I believe the scan is related to the current recognition programs that you have, and the elements within those recognition programs and the stages of development you are in. Is that correct, Lisa?
That's correct. Yes. And I recognize that somebody in the question and answer stated that talked a little bit about the duplication of work for managers. We're as an EIIC, we're not aware of the details that are being requested from the different entities, but we will certainly do our best to minimize the ask moving forward.
Right, looking through the chat, we'll make sure we don't miss any questions.
I think the only other comment I'll make is I know that there were several of that you all that wanted you wanted a snapshot of what it looks like across the country. I'm really hoping that this tool is helpful for that. It will help you connect to your peers and colleagues. And we're hoping it'll provide good, useful information for you. I do apologize if it seems like extra work. I know there's a lot going on, but we really do want it to be a benefit to you. And I'm confident that it will be once it's completed.
Ellis, can you drop the dates and times in the chat for the performance measure implementation manual webinars. I think there's 2 scheduled, and I just don't have them off the top of my head.
Yeah, she's working on it. She's gonna
Okay,
post.
awesome. Thank you.
Looking back through, I think we've addressed questions in the chat. If it got lost in a thread, feel free to throw it in again.
Oh, I'm sorry. The webinar details have not been released yet, so you should be seeing that soon from Alice Perez from her CMSC in the near future.
Feel free to use that Q&A feature or drop it in the chat if you have any more questions for us. Like questions have stopped coming in. So again, we want to thank you all for joining us today. We really want to we appreciate you all joining us today. If you have any additional questions about the collaborative, please reach out to the collaboratives at EMSC Improvement Center, and we'll be happy to help with that. Again, you'll be receiving some communication on Friday from us about next steps. We're really excited for you all to be joining us in Austin in September. We hope that it's a little bit cooler here by the time that you all get here. But we look forward to seeing you all and starting off the all grantee meeting with our kickoff event during the pre-conference. And if you want to stick around, if you have any more questions, feel free. And if not, have a great rest of your day.